Cognitive distortions. What are the different types of cognitive distortions? In the 1960s, psychiatrist Aaron Beck pioneered research on cognitive distortions in his development of a treatment method known as cognitive behavioral therapy. Since then, researchers have identified at least 10 common distorted thinking patterns, which are listed below. Polarized thinking. Sometimes called all or nothing thinking or black and white thinking, this distortion occurs when people habitually think in extremes. When you're convinced that you're either destined for success or doomed to failure, that the people in your life are either angelic or evil, you're probably engaging in polarized thinking. This type of distortion is unrealistic and often unhelpful because most of the time reality exists somewhere between the two extremes. Overgeneralization. When people overgeneralize, they reach a conclusion about one event and then incorrectly apply that conclusion across the board. For example, you make a low score on one math test and conclude that you're hopeless at math in general. You have a negative experience in one relationship and develop a belief that you just aren't good at relationships at all. Overgeneralization has been seen with post-traumatic stress disorder and other anxiety disorders. Catastrophizing. This distorted type of thinking leads people to dread or assume the worst when faced with the unknown. When people catastrophize, ordinary worries can quickly escalate. For instance, an expected check doesn't arrive in the mail. A person who catastrophizes may begin to fear it will never arrive, and that as a consequence it won't be possible to pay the rent and the whole family will be evicted. It's easy to dismiss catastrophizing as a hysterical overreaction, but people who have developed this cognitive distortion may have experienced repeated adverse events, like chronic pain or childhood trauma, so often that they fear the worst in many situations. Personalization. One of the most common errors in thinking is taking things personally when they're not connected to or caused by you at all. You may be engaging in personalization when you blame yourself for circumstances that aren't your fault or are beyond your control. Another example is when you incorrectly assume that you've been intentionally excluded or targeted. Personalization has been associated with heightened anxiety and depression. Mind reading. When people assume they know what others are thinking, they're resorting to mind reading. It can be hard to distinguish between mind reading and empathy, the ability to perceive and understand what others may be feeling. To tell the difference between the two, it might be helpful to consider all the evidence, not just the evidence that confirms your suspicions or beliefs. It has been found that mind reading is more common among children than among adolescents or adults and is associated with anxiety. Mental filtering. Another distorted thought pattern is the tendency to ignore positives and focus exclusively on negatives. Interpreting circumstances using a negative mental filter is not only inaccurate, it can worsen anxiety and depression symptoms. It has been found that having a negative perspective of yourself and your future can cause feelings of hopelessness. These thoughts may become extreme enough to trigger suicidal thoughts. Discounting the positive. Like mental filters, discounting the positive involves a negative bias in thinking. People who tend to discount the positive don't ignore or overlook something positive. Instead, they explain it away as a fluke or sheer luck. Instead of acknowledging that a good outcome is the result of skill, smart choices, or determination, they assume that it must be an accident or some type of anomaly. When people believe they have no control over their circumstances, it can reduce motivation and cultivate a sense of learned helplessness. Should statements. When people find themselves thinking in terms of what should or ought to be said or done, it's possible that a cognitive distortion is at work. It's rarely helpful to chastise yourself with what you should be able to do in a given situation. Should and ought statements are often used by the thinker to take on a negative view of their life. These types of thoughts are often rooted in internalized family or cultural expectations which might not be appropriate for an individual. Such thoughts can diminish your self-esteem and raise anxiety levels. Emotional reasoning. Emotional reasoning is the false belief that your emotions are the truth, that the way you feel about a situation is a reliable indicator of reality. While it's important to listen to, validate, and express emotion, it's equally important to judge reality based on rational evidence. Researchers have found that emotional reasoning is a common cognitive distortion. It's a pattern of thinking that's used by people with and without anxiety or depression. Labeling. Labeling is a cognitive distortion in which people reduce themselves or other people to a single, usually negative, characteristic or descriptor, like drunk or failure. When people label, they define themselves and others based on a single event or behavior. Labeling can cause people to berate themselves. It can also cause the thinker to misunderstand or underestimate others. This misinterpretation can cause real problems between people. No one wants to be labeled. How can you change these distortions? Identify the troublesome thought. When you realize a thought is causing anxiety or dampening your mood, a good first step is to figure out what kind of distorted thinking is taking place. Try reframing the situation. Look for shades of gray, alternative explanations, objective evidence, and positive interpretations to expand your thinking. You might find it helpful to write down your original thought, followed by 3 or 4 alternate interpretations. Perform a cost-benefit analysis. People usually repeat behaviors that deliver some benefit. You might find it helpful to analyze how your thought patterns have helped you to cope in the past. Do they give you a sense of control in situations where you feel powerless? Do they allow you to avoid taking responsibility or taking necessary risks? You can also ask yourself what engaging in cognitive distortion costs you. Weighing the pros and cons of your thought patterns could motivate you to change them. Consider cognitive behavioral therapy. Cognitive behavioral therapy is a widely recognized form of talk therapy in which people learn to identify, interrupt, and change unhealthy thinking patterns.